I've worked, history-wise, I've worked at West Covina, Queen of the Valley, went to Kaiser, and then I went to Riverside Community, and then I came to St. Jude. So I'm familiar with the Philips equipment, and also the GE equipment I am, but the new one that they built in, I'm not very familiar. That's why Evelyn came in, so that, thank goodness she came in, which is like a refresher course for me. Again, these buttons, they're not touchscreen like the other one. It's an actual button. This here correlates with this here, table Bucky. This here correlates to the wall Bucky over there. And this is tabletop up here. So this here goes in and out. And you hear that? What does that mean? It detent, right? Yeah. It's locked, it's in position. Now the next thing you want to do is making sure that you detent to the table. So let's say I'm using the table Bucky here. Got to make sure I'm on table Bucky, right? And I got to make sure that I have a cassette here. Can someone go grab me a big cassette, which is a 14x17 cassette? It's a CR cassette, anyone.
What's the difference between these two buttons?
This is Tomo button. So when you're doing Tomo, when you use Tomo, it's like taking slices of anatomy. Most of the time we use this for like an IVP, right? An IVP is an intravenous pyelogram, right? Which focuses on the kidneys. So what they usually do is take 3 slices of the kidney shot, kind of. Yeah, so thank you, my dear. So right now, at majority of the facility, if they are still in FEM, they're probably going to transition to CR. If, you know, I think next year it's going to become a law that every facility has to go to digital. So you might not see these anymore. If you do see them, they just won't be reimbursed the full amount. That's it. They want you to kind of go totally to digital. So this way is lengthwise, which you push it, and then it will hold the cassette with these levers right there, okay? And then when you turn on the light to make it detent, you move these buttons here. And again, the color up there and the color down on the tube coordinates with each other. So let's say if I'm on here and I push this in, this will make an exposure, but do you think you're gonna get the whole anatomy? No, right? Because you got your patient's here and your cassette is all the way over here. So what you want to do is make sure that the tube and the cassette is already lined up and the patient moves last, right? So make sure your tube is lined up. By pushing this light fill will give you a laser. It's very faint, so right there. So this is all lined up now. This system here will go all green once it's ready. But because of the fact that this is a table Bucky, I don't think it's all green, but at the facility where I work at, everything has to be green before it exposes. So we close this up by pushing this, okay? I know that. This here will control, just push it in. And then this here will also control moving it from side to side too. So if you don't want to mess with your tube, once it's detented already, you can move it down here. So now that's all set. These lever here will move the patient. Side to side, just this way, right? And then the light goes there. If you turn off the light for me, yeah, you can kind of see where you can collimate the full size of the cassette. Lengthwise, you want to open it all the way up because remember we're doing the T-spine. And then this is, you want to collimate as much as possible, but don't, you know, cut off the anatomy, right? So you can use this just by adjusting. And just by looking at this phantom here, you'll have C6, 7, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to T12. So that's how you position for an AP, anterior to posterior, thoracic spine x-ray. Okay, so you guys can play with the equipment. Do you want me to show you the chest x-ray wall? Same thing. Okay, so go ahead and, I don't know if you want to move there or here because it has to be here. So when you move this, remember you're not supposed to use this, okay? So again, blue, if you want to turn on the light now, you can, huh? So what I'm going to do is set up for a chest x-ray, which always use 72, or your AC joint, which is right here, they use 72 distant. 40 distant is shoulder. You remember what I told you? Anything you can do flat on the table, you can do it upright if the patient's hurting, right? So you ask the patient, are you more comfortable standing or are you more comfortable, lying down? If they say, I don't care, what's the easiest you think? What do you think is the easiest to save time? I'm gonna teach you how to be efficient in X-ray, okay? So standing is easy, right? So they can get up, but the most important question to ask when you're working in the hospital, when they can stand, ask them, did you take any medication? Did they give you any pain meds, right? Because if they have any pain meds, that's gonna alter their judgment, right? So then you would do them lying down. So, chest, shoulder, X-ray, and also, what else is there? Anything pelvis, standing up, whatever, but you have to document that it's standing, okay? So we're gonna set it up at 72, chest X-ray. I'm gonna hit this wall, Bucky, my blue, I'm gonna detint it to the wall, and it will click once it's ready. That's detinting. So it comes down this way, right? The yellow button, vertical, and then the black button will turn the tube facing the wall detector. And then again, the green, if you ever forget, and it will come close, and it should detint at 72. If it doesn't, you can measure it, but it detinted, as you can see. Did you hear that? Right? Once you play with the room, you'll feel it. And again, you gotta make sure, sometimes the tube angulation, like visually, this looks like it's straight, right? But if you don't have a green button, you're not straight on. So what you're doing is there's a little tilt of 2 to 5 degree angulation. So you wanna make sure that you have a green light button, that your angulation is good, you're at 72, and if you turn off the light, it's open to a lengthwise, probably 16 by 16 all the way. You can probably bring it up. And I don't think this tracks it, meaning it flows with it, like the other one, master and slave, as Evelyn says. Let's see.
Let's get out of the way here. Who's going for you?
So there's 2 sets of buttons on this side and
It should be up and down. Oh, here. Come on over here, guys. So whatever you can control there, you can control it here. So let's say the patient's here, and I guess it doesn't track it. This here is supposed to be tracking, but it's not tracking. So maybe if I come over here, let me get the cassette out. Maybe I'll track when I have the cassette. So the way you put the cassette in here is the same way. It has a wall, Bucky here, right? And then we're doing it lengthwise for someone tiny. Push it in, let's see if it'll track. No, most of the time when you hit this green button, it will track it the same way as Evelyn says over there. Okay, these buttons here, the up and down button will maneuver it vertically. This button here with the angulation will also move it up and down, which we don't use often, but at the hospital, if you have a Philips equipment, try to play with the equipment on the side, because you can do a hand x-ray on here. If you move it down and you lay it flat like this and the patient can stand, guess what? You do your hand x-ray just like that, 40 distance still, right? You bring that close and make sure it's 40 distant. Of course, you're gonna bring it down a little lower. If a patient's on a wheelchair, you want them right under there. Okay, so, know your equipment. That's why I said, make good use of the room, learn your equipment, so that when you go to your facility, you're like, oh, you're comfortable. It's not like second nature yet until it's your second internship, it becomes a little bit more second nature. But in the beginning, know your equipment, play with your equipment, get used to it, so that you're able to, at ease, talk to the patient more, care for the patient, and the whole positioning is like second nature to you, okay? So I'm gonna give you guys a moment to do whatever you guys want, play with the wall, play with the table Bucky, and then afterwards, with this room here, we only could use the CR cassette. So once you guys play a little bit, we'll learn about the CR reader there, how to bring it up, because I think Dr. Fernandez puts all you guys' information in already. So when you do your first experimentation, you're going to use that cassette, you're going to scan it under your name and develop it under your name and send it through, and once it's sent through, it's going to go to the PAC system here. So everything's just connecting to each other, okay? So I'll give you guys a couple minutes and we'll come to the CR reader.